The Boku Presbyterian Hospital is the only referral facility in the eastern part of the Upper East region, serving about 5 districts and 2 neighboring countries, Burkina Faso and Togo. The hospital is undoubtedly one of the busiest in the country and always overwhelmed with patients, including pregnant women. Until 5 years ago, the maternal mortality rate was very high. But Dr. Clement Opon says one quick intervention overturned the situation.
I think that putting an obstetrician here has been a big intervention in the fight against maternal mortality in the region, because in the past all referrals end up in the regional hospital. The roads are so bad and the ambulances were not there. But now if you have an obstetrician on the ground here in Boko, then it means that most of the difficult cases could be dealt with here without being referred to Bolga Regional Hospital. So that has been a very, very big and major intervention. In fact, as I speak to you now, we have 2 obstetricians in the town in Boko. There's 1 obstetrician and 1 private hospital who is also doing so well to complement the work I'm doing in this hospital. So these 2 obstetricians, as I said, have been a major intervention, so that most of the referrals that come from the CHIP compounds, the health centers in all these 5 regions, 5 districts that I've spoken about, are dealt with without necessarily referring them to the regional hospital.
The numbers were not there. The midwives were very scanty. As for the doctors, don't talk about them. I mean, when I went to Upper East region, there were about 11 doctors in the entire region of 1 million population. So you can imagine how 11 doctors, probably who are doing various things, will be able to fix all the health problems of the region.
Dr. Koku Awono Williams is one man whose name comes up in almost every conversation I have engaged in about how the fortunes of the Upper East region turned around regarding maternal mortality. Some drastic actions he took during his 8-year stay in this region as the regional health director changed the story.
So my first attempt was to attract doctors to the region. I mean, not waiting for national to post doctors, but how do I use my own influence as a regional director to be able to attract doctors? So I did that, and I think within about a year, we had about 17 doctors, and we kept counting.
After solving the problem of doctor shortage, Dr. Awuno moved to other essential areas to complement the work of the doctors.
I think the whole region, we had about very few anesthetists, about 3-4, that were rotating between the district hospital and regional hospital. So the first thing is, sometimes when you want to address problem, I think you have to go against the norm. People always say that if you do the same thing the same time every time, you get the same results. So what I did first was say, look, this policy of somebody who is going to be trained must graduate, work for 3, 4, 5 years before you move on to the next level of training is abolished. We define critical areas like anesthesia, midwifery, critical care nursing, you know, and say that, look, even if you have done 1 year after graduation and you want to go to school, if you want to do these programs, you go and do it. So that's the first thing we did. And within a year, we had about 3, 6, 5, 7, 8, 9 people going to do anesthesia. So now that region should have a lot of anesthetists. 13 districts in Upper East. Every district must bring 5 community health nurses that must go to school to be trained. So within a year, the second year, we produce 65 midwives.
Wow.
And these midwives come back and they will go back to the community they are serving. So the highest proportion of midwives in Ghana, in any region, is the Upper East region. There's no doubt about that.
Stella Mary Adepesa, Boko Municipal Health Director, tells me more education is needed, else all these efforts may go down the drain very soon as people's cultural beliefs and traditions continue to compete with the many interventions by health officials here.
This issue of use of herbal concoction to facilitate labor or to speed up labor, So when they come, at times they won't tell you until you later on go to the community to do, in case the woman dies and you go to do a follow-up, then you get to know that before she came, she even took something. You know, the women, they want to come so that within the next hour they have delivered. So they will hide and take this, which we were, through education and focus group, it came out, and then we are working on it. So currently, when we are using the radio stations to educate everybody.
As the rainy season approaches, I dread for the lives of pregnant women in another community called Jentinga. The community has a CHIPS center, but deliveries cannot be conducted there. It is cut off from other towns, especially when it rains. I get here and I feel a total change in weather, the environment, and even their living condition. It is very close to Burkina Faso, and everything around them confirms poverty is very rife here. It is school hours, but I can see a number of children roaming. The few I have seen in school uniform are rather struggling for water at the community mechanized well. The CHIPS center here, which is supposed to save especially the lives of pregnant women, rather looks sick and needs a lot of support. But this is all there is to save lives here. Sadly, there are no midwives at this center to conduct the deliveries. The in charge, Abubakar Abdulrazak, reveals.
We don't conduct deliveries. We don't have a midwife, neither even a facility to conduct delivery. Courtesy Kwaika and then management committee, we are trying to put up this small structure to be able to conduct delivery, because when I came, I thought it wise that if you are not able to do that and it's rainy season and the client is in a critical state of delivery, which maybe she will not be able to deliver, might need CX. If it's rainy season, you can't cross. So what do? So we thought it was that we'll put up this structure. If we are assessing the client and we realize that the presentation is not good, we quickly refer to the nearby Presby Hospital.
There is one hard truth Razak tells expectant mothers likely to have their babies in the rainy season. It is better to relocate to family and friends in the next village before the rains start.
The major challenge is the road. When it's rainy season, it's very bad. And as a result of that, when a woman is pregnant, we always advise that they should, if they have relatives at the health center, they should be with them. So when the labor sets in and there's any complication, they can quickly seek for medical attention. Because when you are here and it happens that you will not be able to cross. So when we go for home visit, we tell them if it's in the rainy season, this is the situation on the ground. In order to avoid the unexpected, they should be at the nearby health center. If they have relatives, because most of them live and go and stay there. So if they have relatives, they should be with them. So that even no matter how heavy the rainfall, they will still be able to seek medical attention.
I leave to have a look at that portion of the road, making life in Jentinga difficult. This is the road that connects Mugnari to Jentinga, and this is the place the health assistant spoke about. Anytime it rains, this place gets flooded, so they can't cross this part of their town to the nearest where there is a facility where women can go and deliver safely. So they've been telling them that anytime you are pregnant, you better move to Mugnari and live with your families, so that when it rains and you are in labor, they wouldn't have any issues getting you to a place where you can deliver safely. So this is the problem that they are talking about. So delays are not only the issues, but also the roads that connect their homes to the medical facilities or health facilities also play a crucial part. In spite of all these, pregnancy-induced hypertension is a major silent killer of pregnant women here in the Upper East region.
Yeah, it's because sometimes it is not picked up early. It's not picked up early, and most of them come from very remote parts of the district, and so they arrived here very bad. Sometimes they come here comatose, and then our ability to resuscitate them, to revive them, is limited, so sometimes we lose them. So I think that the basic thing is about picking it up and then reporting or referring to the center early. That has been the biggest problem we are facing now.
Pregnancy-induced hypertension is also known as preeclampsia. It kills nearly 200 women across the globe every day. Approximately 72,000 pregnant women die every year because of eclampsia and severe preeclampsia. That's according to the Journal of Obstetrics and Gynecology of India. Preeclampsia ranks second only to hemorrhage as a specific direct cause of maternal death. There are so many widowers as a result of that. Zach Ohimiteria is one of such victims.
We slept on one bed. So that moment when you sleep on the bed and something struck you that where is she? And she's not there. That is the most difficult part of my life. It has remained the most difficult part of my life till now. When you remember somebody who was with you just a day, yesterday, and today she's not there, that is very, very, very difficult. And that affected me, so I had to move away from the matrimonial bed to sleep on the floor.
Ohimi's wife died 7 years ago, but the memories of her death remain fresh in his mind. It all started on July 25, 2010, when his wife left home looking strong and healthy for normal antenatal care at the Centreso Government Hospital in Kumasi. That was when it was announced to them she had preeclampsia. She was immediately rushed to the Konfenochi Teaching Hospital for a surgery to remove the baby. Ohimi didn't know it was a journey of no return.
I started preparing the house for the arrival of both the mother and the baby. So I was there when a friend nurse, then at Konfenochi, and my sister brought the bag, my wife's bag, the bag that contained the things that they will ask any expectant mother to bring to the hospital. They brought it home, and I was like, how come you've brought the bag, and where is she? And they said, oh, the nurses at the ward asked them to bring the bag because they thought that once she's not back from the ward, there's opportunity for people to steal the items around her. And I was, what are they doing? Because that's what they've been paid to do. If you are in charge of a ward and somebody steals a patient's bag or belongings, what do you do? So at a point, it dawned on me. So all that I could say is, if the person has died, you just tell me that indeed my wife is dead, then I'll be okay.
What he felt was exactly what had happened.
Whilst in the process of, engaging them in a banter as to why they've brought the bag home, I felt some sort of black, darkened moment in my life. I don't know how to explain this, but it's like I've entered the room before and the place is so dark for a few seconds, and the place is, light is introduced in the room. So that is what I felt. So it beckoned of me to ask them, if the person is dead, just tell me she is dead, and stop these stories, and stop telling me this story. So that is where they all broke down in tears. So for me, that is when I got to know that my wife was normal.
Ohimi rushed to the Konfenochi Teaching Hospital and saw the lifeless body of her wife on a covered stretcher being wheeled to the mortuary.
They brought the body on the stretcher, and I said, yes, now I know she is dead.
What did you do when you saw the body?
I didn't cry.
Did you touch the body?
I didn't touch the body. I just wanted to confirm that indeed she was dead, and I got the confirmation.
In Accra, the nation's capital, preeclampsia kills more women than any other maternal health complication. Accra also records the highest number of maternal deaths in Ghana. That's according to the immediate past regional health director, Dr. Linda Van Otu.
They go in to deliver with very high blood pressure level. Some of them, when they are pregnant, before they became pregnant, they did not have blood pressure or hypertension. But through the pregnancy, you find that the blood pressure goes very high. So high that some of them can even faint. And then some of them, unfortunately, die. And once the baby is inside, when this happens, then the mother loses her life and the baby also loses his or her life. We have had blood pressure readings that are unimaginable.
Like?
One of them went to as high as 300, over 180. And that is unimaginable.
Kwewa Kwelabi Ofosuapia survived this. She lives here in Accra with her husband and their only child. But for preeclampsia, she should have been a mother of 3 by now. She narrowly escaped death twice.
I had attended antenatal for 27 good weeks, a whole first degree holder. I was as ignorant as anybody else. Even my mom, who had it, couldn't, for whatever reasons, didn't tell me, even though I knew she had lost some babies. The nurses or whoever who saw whatever sign, because it just didn't start that night. I had the symptoms, headaches, you get big unnecessarily, but nobody said anything. And so it's ignorance that killed my baby. I'm lucky to have survived eclampsia because it affects the brain. It just, some people just don't survive. And when they do, they are like nothing, robots.
Yes, she survived the first one, but the baby did not. She conceived again in 2013.
This time I did my antenatal care for 6 months only in Ghana. And then I went to the States. Whilst I was doing antenatal here, I didn't get any symptom of preeclampsia. But when I got to the States, at 34 weeks, the symptoms started. But you see the difference there for whatever they did. They managed me until I was 38 weeks and then delivered to me a safe baby girl who is healthy today and is about 4 years. And I returned home, no complications.
According to the Journal of Obstetrics and Gynecology of India, the risk that a woman in a developing country will die of preeclampsia or eclampsia is about 300 times that of a woman in a developed country. It appears the story of Kwewa confirms this research because there was a repeat in Ghana in 2017.
One Saturday, I was just extremely tired. It was very unusual. And because of my history, we're always checking our pressure. So my husband was like, we should go and check my pressure at the hospital. We got there and my pressure was 150/100. The GP said he has to detain me. I was like, oh, GP, you give me the antihypertensive drug. I'll take it tomorrow morning. I'll come. Then he called the specialist and he said he should detain me. I was there for 4 days. They were doing the routine, checking fetal heartbeat, you know, checking, advising you to do kick counts and all that. And then on the 5th day, in the morning, the night nurse comes to check fetal heartbeat. Nothing. Matron comes around 11 o'clock, checks again, no beat. Then they call the doctor who comes in around 2 p.m., confirms with the scan and says, I'm sorry, but we lost him. So this time the baby did not even come out. He died in my room.
Because of her previous surgeries inducing her to have natural delivery didn't work, so she had to be cut again to remove a dead fetus out of her stomach. It is very rare for pregnant women to survive this because of how it strikes. Dr. Linda Vanotu again.
Now let's come back to how bad is it in the Greater Accra region?
Yes, in the Greater Accra region, over the past 4 years, we measure maternal mortality in terms of 100,000 live births. So if we had 100,000 women delivering live birth babies, they look at how many of them died or would probably die. In the Greater Accra region, it's about 200 per 100,000 live births. But over the years, it is going down gradually. Gradually, it is going down. If you look at the absolute numbers, we find that there is some reduction. And if we have more women delivering, then Even if we have, let's say last year we had 200 and this year we have 200, but last year 100,000 women delivered, then you have 200 per 100,000 live births. That's if they had 100,000 live births. If this year we still have 200 women unfortunately losing their lives, but we had 250 or 150,000 women delivering, then you see that the ratio would go down. So in the Greater Accra region, I would say that we still have to reduce our maternal mortality because we are not happy with the numbers that we see. As at the end of the third quarter, 2017, we have recorded 152 maternal deaths. Yes, absolute numbers. But you see, we have big facilities here, and the places that we have a lot of these deaths occurring are the facilities that are big, because they will receive referrals from the smaller facilities where they cannot do some interventions that can be done in these big facilities. So if you look at the region, you find that the metro, we have Ridge Hospital here, we have Kolebu here, and these two facilities alone receive a lot of clients. We have 37, we have Police Hospital, we have other facilities like that, Chimota and the rest. So these facilities within the metro receive a lot of cases from even outside the Greater Accra region. But for me, whether it is coming from outside Greater Accra region or not, doesn't matter. What matters is that these are women who need more care than wherever they were could offer. So it is important. You understand? If you look at the region again, the districts or the municipals that record fewer.
According to experts, the health of women and children has become established as one of the most important indicators for measuring a country's level of development. The World Health Organization, for instance, explains that the well-being of societies is directly linked to the health and survival of mothers and children. When mothers survive and thrive, their children survive and thrive, and societies prosper. For Kwewa, enough is enough. She is unwilling to risk her life again in an attempt to have another child.
Anybody hearing me now with what I'm about to say will say, what kind of a woman is this? But I pray to God, telling him not to give me a baby. I pray. That is the sort of prayer I pray. There are times where I miss my mess and they're like, oh, the babies. I'm like, is that normal? It's not, because I said I don't want to go back to that operation room. It's a very scary place between life and death. And if you have to go there twice, like I have, go into so much pain and come back with no baby to compensate your wounds, then I really can't go there. I can't go there again. And so I told my husband, I know I'm still young, there's a potential, but I'm done. I tell the doctors, and they're like, oh, well, now that we know yours is like a hereditary thing and you're like high risk, we can manage you. I'm like, no, I want to be there for the at least one that I have.
And her husband, Dennis Ofuswapia, supports the stance.
In my view, I think it's okay. That is what I keep telling her, because it is life-threatening, and she has gone through this 3 times. Even Dioli, she had it, but it makes us almost draw the same conclusion that because of the system where she found herself, they managed to keep it down for at least 2 weeks before finally they took Dioli out. So she has suffered too much, and I think that you have one child. It's okay. Others don't have, but they are there. So as far as I'm concerned, I think we can live and be okay with ourselves, with our child, and move on with our life.
Nobody jokes or plays with death. Undoubtedly, it is one thing most people are afraid of. Pregnant women, however, face this on a daily basis, and it is the reason pregnancy is seen as a death and life matter. Strangely, in the Greater Accra region, where there are scores of medical facilities with all the adequate equipment and experts, it is rather in this region that more pregnant women die than any other region in Ghana. Dr. Linda Van Otu has the Ghana Health Service statistics to support this.
You know, we measure maternal mortality in terms of 100,000 live births. So if we had 100,000 women delivering live birth babies, they look at how many of them died or would probably die. In the Greater Accra region, it's about 200 per 100,000 live births. And I would say that we still have to reduce our maternal mortality because we are not happy with the numbers that we see. As at the end of the third quarter, 2017, we have recorded 152 maternal deaths. Yes, absolute numbers.
Even though it has reduced comparatively with previous years, but we still think it's on the high side because even one woman should not die. Who would like the wife to die?
Assuming that mother is your sister, how will you feel? It's not just a death, it's a death of a family because it's a woman. And no woman should die while giving life.
You remember probably that one of our great-great-great-grandfathers said that if you educate a woman, then you educate a whole nation. Because this woman would have an impact in how the children's life become in the future.
One of the main things you should target is to make contraceptives available and break down the myths concerning contraceptive usage.
According to the 2016 Ghana Health Service report, the Greater Accra region is facing what they call no-bed syndrome, where pregnant women who have been referred are moved around from one facility to the other, being sent away because there are no beds. This situation results in the client finally being attended to only when the condition is very critical. Dr. Linda Vanotu says addressing this issue will save the lives of more pregnant women.
Because you see, some of the facilities have been there for a while, and the population, I believe, at that time was not like this. Sometimes women are referred from lower levels to higher level, and by the time they get there, the whole place is full. If you go to some of our facilities and you see the number of women who are there, you will appreciate what we are talking about. For example, a few months back, Tema General Hospital was a big challenge to have space to keep some of these women. Some of them sit on benches waiting for space.
Director General of the Ghana Health Service, Dr. Anthony Nsiasari, has an assurance for people like Kwewa and her husband who have decided not to have children again for fear of death.
It is not a curse to be a mother. It's a blessing. It's a joy that you have a baby. And we are doing everything possible for such a mother not to be afraid to get pregnant. No pregnant woman should be afraid. They should be bold. They should ask questions when they go to hospital. When they go there and anybody misbehaves or tell them something that they don't like, they have 3 avenues. They can complain to the hospital managers, they can complain to the regional or district managers, they can complain even to the professional bodies.
But is this enough assurance, and would our mothers, wives, sisters and daughters have the needed confidence to exercise their God-given right and biblical command, which is, be fruitful and multiply and fill the earth and subdue it? The double pains is enough. This has been Seth Kwame Boateng for JoyNews' Hotline documentary.